Globally, the way we think and talk about cancer has changed. Increased access to care and major advancements mean, thankfully, that more people are surviving cancer. However, more needs to be done for these benefits to be realized in regions outside of North America and Europe. The Asia-Pacific region has more than half of the world's population and more than half of global cancer deaths. We need to think about the full cancer continuum, from prevention and screening to diagnosis, treatment, and various care needs to save more lives in the region. In APOA, we are collectively working towards a future where patient and community advocates are meaningfully engaged in health system solutions to improve cancer survivorship. Prevention, healthcare, and quality of life services are consistently and sustainably funded. Local clinical leaders are helping drive change and collaboration. There is health system capability, capacity, integration, and infrastructure to provide high-quality services. We can access and share high-quality information and data for the best decisions. All countries and markets globally have room for improvement in these categories, and everyone would agree these enablers are needed. There are major economic and social benefits to preventing and treating cancer. However, decision makers need to balance the need for better cancer prevention, treatment, and care with major challenges, including economic issues, growing healthcare expenditures, aging populations, increasing chronic diseases, and high costs for new technologies. So sustainability and value for money must be considered for new investments. These changes we are advocating for are complex and multifactorial and can be overwhelming when you look at them all at once. But we know that great change can happen to improve cancer outcomes. We have seen many examples across the region of amazing people doing amazing things. Our APOA report includes 36 case studies of inspirational examples, and we could have included many more. But the positive examples often require local heroes to go way above and beyond to fight against the system barriers for change. We need to make it easier for collaboration and shared leadership to improve cancer survivorship in the region. So how can we get more transformational change with limited resources? How can we reduce duplication and increase collaboration? How can we take on barriers together? How could we make sure that things that matter most to patients and carers are included? Standard imported or one-size-fits-all cancer solutions don't work and risk inefficient and inappropriate use of limited resources and people's times. Initiatives need to consider local needs, culture, resources, leadership, and health systems. Many countries have a national strategy or cancer control plan that identify key areas for action. Where to start and how to proceed with tangible action requires strategic planning and system thinking. Transformational changes require shifts in policies, practices, resource flows, relationships, connections, and beliefs based on the local context and local leadership. These shifts require collaboration. The APOA team looked at systems change literature, conducted over 100 interviews, and reviewed many positive examples of how the best changes happen. Learning from what has worked before and considering systems change, we developed a framework for change, one that puts the patient perspective as a clear enabler of the best changes. The framework includes 6 major components for how to drive the best initiatives. An inspiring vision for change. The right vision, communicated well, can bring people together across silos and standard ways of working. Information and evidence to support action. Considering the current situation and opportunities, gaps, how the system works, relevant evidence, research, best practice, and key players. Working together. Collaboration and shared leadership to improve outcomes for patients. Powerful patient voices where patients are valued and organized. Patients are meaningfully involved in shape policy and program design, research, data generation. Broader community engagement with civil society includes information and public perceptions of disease. breaking myths, reducing stigma and discrimination, and engaging the community in advocacy. Shared investments and actions from different sectors, including sustainable and innovative financing and investments of time and expertise from different groups. Initiatives which meaningfully include the patient perspective are based on local needs, collaboration, and shared leadership will lead to better outcomes for the community. Let's work together with the framework to bring better outcomes and save more lives in the region.